I really appreciate the opportunity. My name is Asieh Golozar. I'm currently with Odysseus Data Services. I'm heading up the data science team. So today I'm going to talk or introduce like a study that we've titled Prognostic Significance of Liver Metastases in Non-Small Cell Lung Cancer. A little bit of a backstory, as you know, I've been working with some of you know, I've been working with the oncology working group for the past couple of years. And in the oncology working group, we've been working on laying out the foundation and providing capabilities within OMAP to be able to do observational cancer research, make it possible. So today I'm bringing up this study as a sort of like a showcase of what we've been doing so far and what it means for the community and how we can use and adapt the oncology module and vocabularies to further cancer research, like large-scale cancer research. So, okay. So liver metastases, like I'm just going to talk about liver metastases in the context of non-small cell lung cancer. You all know lung cancer is the most common cause of cancer death in the world. Majority, like during the past decades, like there's been like advances in the treatment of specifically non-small cell lung cancer that's pretty much had like a huge impact on patient lives. Up to around 40% of non-small cell lung cancer patients are generally diagnosed with metastases. That's at that time, like the prognosis of the disease is pretty much bad. But this is specifically very unique with liver metastases when you see like even worse prognosis of when a patient is actually presented with liver mets at the time of diagnosis. We're talking about like a median overall survival of around 4 months, and if it's untreated, the survival is less than a month. In terms of response to treatment, these patients generally have very, very poor response to treatment. A lot of it is because when liver is involved, you have like your liver is not functioning very well. So these patients are generally on low performance status, and a lot of the medications that actually can work, they cannot even tolerate it. And also, there's a lot of like immunotolerance happening in the liver, and the interaction between the host environment and the liver cells creates some sort of immunosuppressive environment that is promoting tumorigenesis and progression of metastases. So generally, that highlights a huge unmet need in the treatment of non-small cell lung cancer patients with liver metastases. There are new treatment strategies, as I mentioned in the beginning, but the impact of these treatments, for example, immune checkpoint inhibitors on patients with liver metastases, is not that well, and also everything that we know about this patient population and how they're being actually, like how they're being treated and how they respond generally is focused on either secondary analysis of clinical trials or very small sets of observational data. So it is important to take a look into liver metastases. We would like that would help us for correct patient stratification to identify the right treatment strategy for patients with metastatic non-small cell lung cancer. Thinking about drug discovery and development and even clinical trials eligibility, that can be actually used for prognostic or either predictive enrichment of clinical trials, and then further the development of new medications for this patient population. So with that, we started like putting this work together, and I forgot to say in the beginning, this is a collective work that I'm just presenting, and this work is actually like started, initiated in collaboration with NCI and one of our collaborators in the University of Alabama. So we divided this work in 2 different steps. We decided in the first step, we're just going to look into the demographics and clinical characteristics of patients with metastatic non-small cell lung cancer, those with liver metastases and those without liver metastases, and also getting a better understanding of like, who are these patients, how are they being treated, and what are their specific outcomes. And in the next, after like gathering this information, we will be at a better stage to look into the prognostic and predictive significance of liver metastases in these patients. So as with any study, we start with defining our target cohorts. Like just think about like a patient, like they're diagnosed, say, with lung cancer at some point in their life, they develop metastatic disease, so metastatic non-small cell lung cancer, and they go on treatment. most of them, and these patients are being followed up until like the end of the observation, death, hospitalization, and so on. So for this specific work, we're looking at two different target cohorts, patients diagnosed with metastatic non-small cell lung cancer. So the cohort entry event would be the time of diagnosis, those without liver metastases and those with liver metastases, and also the subset of these patients who initiated a treatment. So we're looking like starting our observational cohort, and a subset would initiated first-line treatment. We're going to look into the patients and also like looking into the outcomes. For specific outcomes, in addition to everything that we generally do within oncology and cancer, where there's a specific interest in looking at specific time frames, time to specific events. Within a population of metastatic patients who initiated treatment, there are three distinct outcomes that we're very interested. Looking at time to treatment discontinuation, time from initiation of the first line of treatment to discontinuation of the first line, or any censoring that happens during that process, time to next line of treatment, from first line to second line, and the most important outcome in oncology research, overall survival, time to death. That's that would be our target cohort, our outcomes, and so far we have set up the study. We have a protocol that is finalized. All our collaborators have agreed on that. We have a package that is ready for dissemination, but I wanted to use this opportunity to call for participations. As you know, cancer research is very complicated. We need more detail. We need data on specific tumor histology. We need death information. We need treatment information to be better understand and do this study. So I wanted to invite all of you guys to come, let us help you. We can actually help you with the OMAP oncology, and bring your data, bring your knowledge, bring your enthusiasm, and join us in this study and other future studies. Thank you so much.